I want to thank all of you for coming to this event. These events are always fantastic when we can celebrate achieving the highest level of excellence in a particular specialty area. Before I begin, I just would like to introduce Kathy Shack. Kathy, if you'd raise your name, she's one of our board of director members. She came early. We got our board meeting today, and so she came early to be able to participate in this event. I don't know if many of you know about how difficult it is to become a comprehensive stroke center and why we set out to work to achieve this as a system. But the American Heart Association and the American Stroke Association has named stroke as the number 5 cause of death in the United States. It's also the leading cause of adult disability in the United States. And as a physical therapist, I've worked with many stroke patients. And there's nothing probably more difficult than to have a stroke and not be able to speak, and yet have your mind as a competent adult, full capacities of your mind. It's kind of like you get stuck in your mind, if you will. And on average, in the United States, someone suffers from a stroke. How often do you think a stroke occurs in the United States? Anybody got a guess? Dr. Wallery? Oh, wow. We got to give him a word. He's right. Every 40 seconds. Every 40 seconds. So a stroke occurs in the United, can you believe that? A stroke occurs in the United States every 40 seconds. And nearly 795,000 people suffer from a new or recurrent stroke in each year. And it's really because of these staggering statistics that we've hired some of the brightest, as Dr. Wallery, stroke specialists, and invested significant resources as a health system in the last few years to develop a system-wide integrated stroke certified program for all of our hospitals across southern Wisconsin and northern Illinois. And today we're here to recognize the stroke team at the Javon Bea Hospital, Riverside, for receiving certification as a comprehensive stroke center, the highest level of stroke certification in the nation. The prestigious designation as a comprehensive stroke center really requires incredible competence in the treatment of patients who've experienced a serious stroke, and affirms Mercyhealth's ability to address the full spectrum of stroke care, from diagnosis and treatment all the way through the rehabilitation and education of stroke patients. There's a multitude of requirements that need to be in place to obtain this high level, the highest level of certification as a comprehensive stroke center. And to achieve this designation to be a comprehensive stroke center, we have to bring together state-of-the-art technology, advanced imaging capabilities, cutting-edge operating room suites, a cutting-edge state-of-the-art intensive care unit, and neuroscience facilities. And most importantly, expertise, and it always comes back to the people in healthcare, expertise in treating the most comprehensive stroke diagnosis. And without a doubt, we've researched this, our stroke team is the most experienced in the region. Our multidisciplinary stroke team is comprised of neurologists, neurointerventionists, neurohospitalists, vascular specialists, and highly trained nurses who work closely with an array of Mercyhealth specialists and support teams. And these support teams include emergency trauma physicians, radiologists, hospitalists, speech, physical, and occupational therapists, dietitians, and nutritionists, pharmacists, and EMS personnel. Working together, they provide the cutting-edge care to become a certified stroke center and to be designated as a comprehensive center. To talk more about what it took to become a comprehensive stroke program, I'd like to ask Dr. John Dorsey, our Chief Medical Officer for Illinois, to say a few words. Dr. Dorsey.
Hello, everyone. Thanks, Javon. So I am an internist, and I remember graduating medical school now way back in 1981. And there was not very much you could do about stroke patients other than really focus on physical therapy and rehabilitation afterwards. And my gosh, things have changed considerably over the years. I mean, it is amazing now when you can take patients who come in severely handicapped from an acute stroke and they can walk out of the hospital. I mean, it is just astounding. But what's additionally astounding is the team that we have who performs those types of events every single day here for the patients and for the community. Excuse me. So it is, I believe, our commitment to excellence that has achieved this certification. Our commitment to excellence as an organization, from Mr. Bea's leadership on down, and to the performance of the care of patients, of both pre-hospital care, in-hospital, and post-hospital care. It should demonstrate to the community that we provide the highest level of stroke care that is available. And it's important for patients to understand that here at Riverside, they have access to specialists that have the expertise and the resources to treat any kind of stroke or any kind of stroke complication. And this is significant not just for Rockford itself, but for all the surrounding communities and all the referring hospitals who can have confidence that when they send us patients, we will deliver the best possible state-of-the-art care. So putting that all together has resulted then in our certification as a comprehensive center. Mercyhealth has a reputation for having built very strong stroke programs throughout our system. MHTC, Mercyhealth and Trauma Center in Janesville, is a primary stroke center. Walworth and Harvard hospitals are certified adult stroke ready. And I can't say anything today, but we'll be announcing soon our designation for our sister facility on the west side of Rockford, so that Rockford residents and surrounding residents can be assured that they are covered for stroke services throughout the community, both east and west. And we will continue to build on and strengthen all these programs so we can provide patients the best state-of-the-art care. So I would like to congratulate the stroke team who has achieved this. And I must say, I've been here since 1987, and this stroke team and this neurology team is superb. It is the best team I have seen in my years here. So thank you all very much, and congratulations.
Thank you, Dr. Dorsey. I next would like to introduce Dr. Sean Wallery, who's our system-wide medical director of our stroke and neurovascular services. And also I'd like to ask Dr. Banzo, our system-wide medical director of neurointervention, to come up and say a few words. Thank you.
Thanks everybody for coming. It's an honor to be here, and it's an honor to be part of the comprehensive stroke program here. You know, with this designation and with the acute treatments that we're now able to provide 24/7 to the Rockford community, I know will make a big difference in not only saving lives, but also restoring quality of life. And for us, that's the most critical thing. Thank you.
Well, thank you all. And for those of you who know me, I generally talk a little bit more. So, but who said yeah? Who said yeah? Oh my gosh. But thankfully my whole speech is on this card, so you know, relax. We'll get through this. Don't worry. I have no more than 45 minutes, I promise you. So I have a little bit more of a historical perspective through all of this, because I've been here even, you know, before and when this whole stroke program began. So just as a little background, I started here in August of 2012. And at that time, I was hell-bent on being a clinic neurologist. You know, in fact, when I was a resident, a few of the residents had said, hey, don't you want to, you know, go do a few more call nights in the hospital? I said, who would ever want to be a hospitalist? Nobody wants to be a hospitalist. No. That's not my path. That's not my path. So I got here in August of 2012, and about a month or two after, one of the current neurologists who was here and serving as a stroke director decided to leave, and they came up to my office and said, hey, do you want to be the stroke director? And I'm like, sure, I guess I can do this as an interim until, you know, you guys find somebody else. And, you know, 1 month led into 2, and 2 months led into a year, and I kind of recognized, hey, you know, we aren't really doing as much as what I thought we should. But remember, this is 2012. So at the time, you know, we weren't much more advanced, and even 20 years before that. interventional care really hadn't done a lot. And we were still kind of afraid of TPA at the time, so we weren't really sure how we were going to transition with the program. But I started to really focus on kind of where we were. Now, I remember very much as an intern, I had this doctor come up to me, and he was a different specialty than neurology, and he came and he goes, "Why would you ever want to be a neurologist? I mean, what can you do with stroke care? You give them an aspirin, push them into a corner, and pray to the stroke gods." Pretty much, right? I mean, that's all that we could really do. So as time kind of went on, we had a team that started. We had interventional management that started first in Rockford to do so. But we didn't really know what intervention was, and it really hadn't been proven so much. So in 2014-15, all of a sudden these studies came along. I mean, that proved just how effective stroke care was and interventional care was. And, you know, I really started to pay attention. We really started to invest our time, energy, and effort into the entire program. But we still didn't have the team in place for what we needed to do. So then along in August of 2016, Alicia came into play and as our stroke coordinator. Now, I don't know if you guys know Alicia, but those of you who do know that she really keeps me on task. And I, honest to goodness, cannot thank her enough, because we would not be where we are today had she not pushed from the very beginning. And I'm going to tell you, in the early years, we weren't as robust as where we are now. I remember one time I felt a little bit down about maybe where our program was and where we could be. We couldn't, you know, we just didn't have that team approach that we needed to have, and she showed me a picture. I'm going to share it with you today. And Alicia knows this picture, right? It's this proverbial picture, right, of the frog in the bird's mouth, right? And it says, "Never give up." And she showed me this picture, and I'm bringing it today because this is the exact picture that she showed me from that time. And what it was about is, hey, look, you know, don't get down on us. Let's go. We're going to get this going. So then all of a sudden came into play, we got Sarah Linder as a nurse practitioner. And all of a sudden things started to pick up. You know, our numbers started to pick up. And just before this, I remember one of the IR techs looked at me and she goes, "You know, Sean," she goes, "I don't think we've done a case in like 3 months." I'm like, wow, no kidding. And I looked back and she was kind of right. And so as we progressed, Sarah started to come on board. We started to get more and more attention to our stroke program. Alicia was really pushing for me. And then the final piece of that puzzle from the management side of it came on board, and that was Dr. Bansal. Now, throughout the years, a few of you remember, we've had a couple of interventionalists here, but they haven't been invested in the program. And Alicia and Dr. Bansal have went out to hospitals, to communities, to clinics, and they've spoken to, you know, groups of 5 and groups of 50, and all of a sudden somebody started to notice who we were. And not just that who we were from a team standpoint, that we were giving excellent care above and beyond. The only hospital around the area with the neurohospitalist program, the only hospital in the area 24/7 coverage by 2 people. And people started to take notice, and our numbers are staggering now, right? Staggering now. And I've got to say that, you know, through it all, John Dorsey, Sue Rips, you guys have, you know, been there, and through the guidance of Javon Bea and his, you know, entire team, really, really appreciative of the opportunities that we've had, and now we're here. And it's been a long road, but thank goodness we're here, and I'm really proud of the entire staff. But I do have to say one thing through it all. The nursing staff has been phenomenal. Absolutely amazing. See, we've asked them to adapt to a climate environment that they were not preparing to do, right? They didn't know. But you know what's amazing? Not one complaint. They come up to me and they ask for education. They want neuro courses. They want better education. They're hungry to learn and to know. This is also true of our CT staff. Remember, at the beginning of this, we were doing a couple CTs a month on stroke, and now we're doing this every day, and we're pushing towards this more and more with more advanced studies, right? We have our imaging, our techs, our IR staff. You know, and it's kind of crazy because the future is going to get even more. There's new studies out which says treat stroke even more aggressively. You know, this is really going to be a challenge and a stress and strain on the system, but I'm so proud that our staff has not only stepped up to the plate, but excelled and exceeded by far in what we want to do as an organization. And the last thing I want to thank Dr. Jay McNeil from MD1 and his entire staff, because he has been our champion on that pre-hospital care, on EMS education, which has presented so many opportunities for so many patients. It's absolutely been amazing. So thank you, Dr. McNeil, because I think he's going to come up and say a few words as well. So thank you to everybody. I appreciate it, and thank goodness I'm done.
Well, thank you, Dr. Wallery and Banzo, for your leadership and commitment to providing the highest level of stroke care. And Dr. Wallery, thank you for keeping your comments to 45 minutes as well. So, our last speaker today is Dr. McNeil, who Dr. Wallery just had all of us thank. But I've known Jay for quite a while now, and to say that he's a breed unto his own would be an understatement. I guess the one story I'd like to share about Dr. McNeil is we were at before a Rockford gala, we were at a pre-function at a physician's home, and there was an accent that was caught in on his radio of an individual who got an axe in his head, and so Dr. McNeil said, well, I got to take off my tux, and he had on his Mercy t-shirt, his Mercy MD1 t-shirt, and it reminded me of the Ghostbuster movie, where the guy goes around and kind of like goes in and takes off his tux and goes off to this deal. So you must be an excitement junkie or something, but I know his wife had even told me that he lives with that radio by his bed at night, and he all I can say is the community should thank God for Dr. McNeil and all his men, and because that pre-hospital care has just risen tremendously as been acknowledged. So Dr. McNeil, please come up and say a few words.
Thank you all for being here. I think that it can't be stated enough how intelligent our first responders are. And with the condition that's so devastating as a stroke, where the difference between going to a primary or an acute stroke ready versus a comprehensive center is a time-critical event. So we need to make sure all of our citizens know the be fast signs and symptoms of stroke. But when our EMS providers get on scene, this kind of takes me back to when you learn in medical school about the pioneers in medicine and the things they did. I don't remember reading that anyone talked to Dr. Bonsall at 11:30 at night and then Dr. Wallery at midnight when there wasn't an emergency situation. We were trying to work on building a stroke screening scale for the pre-hospital providers. So we've built this screening scale, so now our pre-hospital providers can know in real time where to take the patient to get them the best possible care. And not all patients need comprehensive care. The ones that do need to get here quickly. Some patients need primary, so we want to make sure that we get the patients to the right destination at the right time to not overwhelm the comprehensive, and also to make sure they're getting the TPA when needed. So what we look at with the comprehensive is the large vessel occlusive stroke. And these strokes are the most devastating. They take out a large portion of the brain, and the TPA that's offered at a acute stroke ready or a primary stroke center does not work on that type of stroke. And that's where those patients need to get to the comprehensive stroke center as soon as they possibly can. Sometimes it's by way of the primary, and sometimes it's directly from the scene. And so what we've worked on is improving our communications pathways. We've worked on a field applicable scale, so we know which patients are having large vessel strokes. But the whole goal, and I don't know anybody's talked about it, and I'm probably not the best to describe it, but this guy here actually puts instruments in your body and actually removes the clot by physical means. TPA can't do that. So we need to make sure that we have both capabilities at our primary and that our comprehensive, as well as our partners in the region that are acute stroke ready. So what we've looked at is not building a comprehensive stroke center, the shining city on the hill. We have looked and we have built a comprehensive regional system of stroke care through our comprehensive stroke leadership. So we've worked with all the partners in the region, and I'm extremely proud of our first responders, from 911 telecommunicator, police officer, deputy, EMT, paramedic, all of them have been involved in this process. And when you have someone at your house or a business that's having these symptoms, you call 911 because they're going to get there with the proper training to make sure that these people get the right care on the way to the right facility. So it's about the right patient, the right treatment, the right time, and getting them where they need to go. We don't like to pit stop people when they need a tertiary care level like this. So it's critically important that we continue to work with this with all of our providers. We take every single case that we do here, we learn from it and improve for the next patient down the line. And that's what's so exciting to work at Mercy, is that constant striving towards excellence. And I'm very proud to be here, and I'm happy that the EMS providers have come aboard, and they're super excited to be part of this. And the stories that these EMS providers tell me from a stroke patient they had several years ago, who is permanently in a assisted living facility, versus a similar patient today that's come to the comprehensive and now they're back to their life and back to their family. So it's just an incredible difference in stroke care, and I'm just so proud to be even a little part of it. So thank you for your time today, and if anybody has any questions about why we do what we do, you can call me at 11:30 at night or midnight, because I'll probably be talking to these guys, and we can do a conference call.
Well, I just been connecting a few dots, and I guess Dr. Dorsey brought me back, but working as a physical therapist in the early 70s, and actually even before I became a physical therapist, working in a physical therapy department as a technician at Rockford Memorial Hospital throughout high school and college. You're right, John. The only thing we could do was basically physical therapy, and I can still think of some of these individuals who had full capacity of their brain, and yet they had, total loss of paralysis of a side of their body as well as of their speech. And just as a young man, I remember feeling, for these individuals, some top executives and people who would have these strokes. And it is just amazing to hear the passion and the intensity of Dr. Bansal and Dr. Waller and Dr. McNeil and all the support team members that they've mentioned. To me, it's really bringing a lot of multidisciplinary team of people together to attack a disease, if you will, like stroke, and really, in most cases, conquer it. That's an amazing, when you've been in healthcare as long as we have, that's really an amazing achievement that I don't know if people can really fully appreciate. So, but obviously, it takes the dedication, the passion, who really want to engage. So I just can't thank our stroke team and congratulate you enough for achieving this highest level of certification as a comprehensive stroke center here in Rockford. Congratulations. And we have refreshments in the back. Please join us. Thank you, everybody.